Hello, my name is Ridge Leox, and I am a former journalist with Newsday in New York. And today is the first of what we hope as several discussions to come with members of Talbot Rising. To my left is Mike Pullen, who is a founding member of Talbot Rising, and to my right is Bob Day, who worked with Kathleen Sebelius as a health finance policy advisor who ran Medicaid in Kansas before she became HHS secretary. So healthcare has been in the news, as you all probably know, and nationally and locally it's been a big issue. So what we thought we might try to do today is kind of bring viewers up to speed on what's happened and where we should be going from here. So first of all, we thought we would start with the Affordable Care Act, trying to understand what that is. It's also called Obamacare. It was passed in 2010, and what it was that the House Republicans were trying to do and replace it. So first I'm going to turn to Bob and ask him to explain a little bit about the ACA.
Well, the Affordable Care Act is an incredibly complex act because, as the President noted, much to his surprise, healthcare is complex. But it's important. The important features to remember is it was designed to try to reduce the number of people who did not have health insurance because health insurance had become unaffordable to them. So many people in America, roughly 15% of the population at that time, did not have health insurance. The Affordable Care Act expanded health insurance in two fundamental ways. One is it expanded Medicaid, a state federal government partnership that has generally been a health payer for low income, the aged, disabled. And in fact, nationwide, Medicaid has paid for 50% of almost all the births in America over the years.
Which is an astounding,
it's an astounding number, and I think very few people
think
understand how
right.
important that role, what an important role it has had. So it's been a shared program, and it's an entitlement. If you qualified by income or lack thereof, you were entitled to this program. There were no mandates that you work or any of those kinds of things. Now, the expansion for Medicaid then was for people up to 138% of poverty could now register, for states that chose to do so, could now sign up for health insurance through Medicaid.
Tell our viewers, what does that mean in terms of money? That's 30,000.
Well, let's talk about it in terms of a family of
four.
Let's talk in terms of family of four. For a family of four, 138% of poverty is $30,600. So for those individuals, they could enroll in the Medicaid, an expanded Medicaid program. Maryland was one of the states that did expand. 19 states did not expand Medicaid, chose not to. The key of that expansion was that the federal government would pay 90%, at the end, would pay 90% of the cost for that expansion. The state would pay 10%. Right. So it really was a good deal for the state.
Right.
And about 60% of the change enrollment in the new ACA programs came from Medicaid expansion. The second was for people who did not qualify, whose incomes were higher than that, they could sign up for health insurance through the health exchange, either the federal health exchange, or in Maryland we have the Maryland Health Exchange, which is basically just a marketplace where you could pick the plan that you wanted. There were generally 4 plans offered, ranging from high deductible, high premium high deductible plans to plans that covered more of the cost. So everything was built around what's called the Silver Plan. Silver Plan is actuarially 70% of all the possible medical costs you could incur. So you were then on the hook for 30% of the costs.
And the Silver Plan was also where the ACA had decided if you were able to get a subsidy. Right, that came from the Silver Plan.
It's based on that. It's based on that plan. Right. So if you chose to have a plan that was more generous in benefits, your subsidy would remain the same, but you'd have greater out of pocket. Mm-hmm. So you did in fact have choice of plans. And that, in for example, Congressman Harris's region, 14,000, roughly 15,000 people signed up on the health exchange for that program. And these are people that would not have traditionally been insured.
Right.
So those are I think the key ingredients. There were subsidies, tax credits, etc., to help defray the cost for the individual. And those benefits, those tax credits and subsidies, really were more generous at the lower income level, less generous at the higher.
So the Republicans voted 60 times since the bill was passed in 2010 to repeal Obamacare, or the ACA. And they came up with a new plan. Speaker Paul Ryan came up with a new plan. At the end of the day, they decided not to put that plan to a vote. Tell us a little bit about how that plan differed from the ACA. Or start with you, and then we'll go to Maryland, I guess.
You know, I think there's several. One is the premiums were the subsidies, tax credits were far less generous. The plan shifted a lot of costs to older citizens. In other words, because it removed a mandate that said, you know, you pay a penalty if you don't get insurance, which young people tend to not do. What it meant is that this plan would eventually have shifted and made for 40, 50, 60-year-olds much higher costs, and the benefit and the tax credits were less, much less, and they were standard. So, in other words, it's very complicated, but the way the tax credits worked on the Obamacare plan was they tried to cap your premium cost at a certain percent of your income. So if your premiums went up, the tax credit went up, so which essentially means that the federal government picked up more of the cost. Under the ACA, under the repeal plan, that none of that occurred. And then the final plan that they decided not to vote on eliminated the mandated coverage items. There were 10 basic coverage items, such as maternity care,
emergency
room
services,
care.
Opioid,
So there were basic coverages that you got, because you know, in insurance you can get plans that really cover practically nothing, and until you.
And you don't pay much for them, but
you don't pay much for them.
Much either. Yeah. So.
So that it got rid of that. It eliminated many of the protections that were in the ACA, and basically, even at that point, and more, perhaps the greatest and most radical thing it did was eliminate this federal-state partnership over Medicaid, and essentially, for all intents and purposes, block grant on a per capita basis, per beneficiary basis, the Medicaid program, which meant the states would pick up increasingly more and more of the costs of the Medicaid program.
So what would that have meant for Marylanders if that bill had passed, do you think?
The estimates were that it would create a budget shortfall of $2 billion a year for Maryland, which would have meant that the state would have had a choice of either substantially reducing medical care services and how medical care is delivered in the state, or alternatively substantially increasing state taxes to make up the difference. Thankfully, we don't have to make that choice because the bill wasn't enacted, but it would have had a very significant financial impact that would have been felt across the board throughout the state by everyone. And as Bob mentioned a minute ago, the change to the way that Medicaid was delivered in terms of changing that to a block grant system was a fundamental shift in that program, and it was completely different than that program has been conceived and administered since its inception. It would have meant also fewer people with coverage, more expensive coverage. It would have created a larger uninsured pool. It would have created a larger amount of uninsured care provided by hospitals. As you know, hospitals are required to provide the care to folks that show up in the emergency room, and the ACA was instrumental in reducing the amount of uncompensated care in Maryland by, I think, about $313 million a year, which is a substantial amount. That would have been lost, and perhaps not just lost, but that amount might have and probably would have increased over time.
So what do you think happened? The other part that we didn't mention was that this included a big tax cut, right? So, you know.
Well, on top of that, and the tax cut, eventually when it had all been cycled in, would have been about $800 billion in tax, in terms of reduced taxes, and primarily on people of extremely high incomes. Interestingly enough, part of the reason the bill failed is that the Congressman Harris and some of his people in the Freedom Caucus felt that those tax cuts should be implemented much sooner than they were going to be, so that the cost really would have been more. And you know, basically, they really believed the government should not have been subsidizing any insurance through tax credits or any other way.
So where are we now? I mean, most people would say that the ACA has some problems. I don't think on either side of the aisle people would say it's a perfect law. What's the way forward, do you think, in this?
Well, I think the question is what's wrong with it?
What's wrong with it? Yeah, let's lay that out. Sort of, yeah. What are issues here?
And part of what's wrong with it is that the mandate for people to have insurance, the tax penalty for not having insurance, probably wasn't strong enough, or isn't strong enough, to really push young people, young healthy people, into the insurance market. So they're kind of more willing to gamble that they aren't going to have a high health care costs, and so they don't buy insurance. The problem with that is then, when healthy people pull out of an insurance pool, it leaves only the sick. And at that point, that's when you create what's called a death spiral. Now, the Republicans have talked about that Medicaid, that the health ACA is in a death spiral, but that's hyperbole. It's not. There are certain states, Arizona being one, who have seen big increases in premiums. But remember that the way that the ACA works is the premiums may go up, but it's really capped. What you pay is capped by your income, percent of your income. So it's a somewhat misleading argument that they make. The second, I think, important thing to remember is that in most places, ACA is working quite well. It's helped hold down costs. It's worked very well. Where it's struggled is in rural populations, and that's a product of, one, not enough well people signing in. In other words, they'd rather pay the penalty, and two, not a dispersed population. So you don't have a large population base to build your risk pool with. Those are all things that can be fixed relatively easily. It's not like the whole thing needs to be overhauled. Those are kind of adjustments that one would have anticipated you would have to do whenever you pass complex legislation. I mean, there have been adjustments. I think everybody would agree that Medicare has been a smashing success. I don't think there are people. I remember when the ACA was being talked about, there were Tea Party people out there said, keep the government out of my Medicare plan. Medicare is a government-run plan, and it's been wildly successful. It's expensive. I mean, in terms of cost, and there are discussions about, needing to increase the amount of money going into Medicare. But the fact of the matter, it's been very successful. It's been very successful in containing costs. But it's required adjustments through the years, and it will require more. So there's no reason to think that the Affordable Care Act can't be adjusted.
Do you think there's the political will to adjust it? I mean, it's hard to figure out what this administration is going to do or what our congressman is going to do. Will they just make it worse through administrative regulations?
Yeah, that's a good question, and unfortunately, I don't feel capable of really answering that because I can tell you what I think, and I can tell you what I would hope. I would hope that our elected representatives will find a way to work in a bipartisan fashion to correct what needs to be corrected. The first thing we need to do is look at the facts and face the facts and recognize that, yes, there are problems. But that's what democracy is. That's what Congress does. They look at the problems and they try to fix them. In this particular case, I think that the problems are fairly manageable. These problems are far less complex than the proposal to repeal and replace the entire Affordable Care Act. And if there is the political will, and that was your question, and I don't know the answer to that, but if there is the political will to get this job done, I feel that it's certainly one that can be done and can be accomplished. And I would hope that the representatives throughout the country will recognize that this is an important issue to the American people. And the American people expect them, each of them, to face the facts, to deal with this issue, regardless of partisan politics, to put it on the table and deal with it frankly, fully, fairly, and honestly, so that the American people will benefit. And the process has to be transparent. We need engaged citizens. We need representatives working together in good faith across the aisle. Whether that can happen in this political climate, I'm not going to comment, but I do think that was the vision that the founding fathers had, and that's the vision that we're taught in our civics class in coming through, and I think that's the vision that the American people have come to expect. And I think that, unfortunately, that's not the way politics works sometimes, and as a result, the American people end up the losers.
So what can the average person do at this point?
Well, I think grassroots advocacy is really a key. I think that grassroots advocacy across the United States has had a positive influence on the course of the bill to repeal and replace the Affordable Care Act. I think the outcome is good. I think that the people who have benefited from the Affordable Care Act will continue to benefit from it. And I think the job now is to dig through the weeds and get out the details, and instead of repealing it wholesale, to fix it. And I think local groups are forming all over the United States. We have a local group here in Talbot called Talbot Rising that has generated a lot of interest and a lot of very talented people, concerned citizens, people willing to volunteer their time to get involved and to speak to these issues that affect everyone. And that's really the essence of democracy. And I think it's democracy working at its best. We all, as citizens, have an obligation. And our obligation is to be informed and participate and make our voices heard. So these citizen groups are an effective way of doing that. And it's constructive. It's intended to aid the discussion and benefit the conversation and hopefully affect change that will benefit us all. And just as an aside, I can add that, the United States is the only major country without a universal health care. And I think the discussion could easily go in that direction. Bob's comments about Medicaid and Medicare being wildly successful, are completely accurate. And if you ask folks that are benefiting from those programs, they virtually all agree. The American people don't want that changed. That's working. And so I think the discussion could well benefit from a shift in focus onto universal health care. We are the wealthiest country in the world, in the history of the world. And the cost of we actually pay more currently for our health care than any other major country. Mm-hmm. And our outcomes are not quite as good. And so there are major flaws that could be addressed. Back to your original question, mm-hmm. You know, if there is the political will, there are major flaws with the way that we deliver health care in this country. The Affordable Care Act is a step in the right direction, but my view is that we need to go further in that direction and ultimately to universal health care.
Do you want to add something, Bob? And then I want to tell people about the town hall.
Well, I think that unless we as citizens can do better than turn out, only 58% of the voters turning out for elections, we're in deep trouble. Mm-hmm. And I think a part of the grassroots, the fascinating thing about the repeal is how it generated so much grassroots activity. Mm-hmm. And I think lasting interest in how we move forward with issues. And the partisanship, I think the grassroots movement helps inform people beyond the partisanship of what the issues are and what the facts are. And I think that's critical to making decisions. And I'm excited. I'm 72, and it's the first time I've been really felt like politics is starting to respond at the level that it should have, that a democracy is going to start behaving the way a democracy should, and that's citizen engagement.
Well, thank you so much today. I just want to put a plug in for the town hall with Andy Harris at Chestertown College on March 31st at 5 p.m.
Chesapeake
College. Did I say that? I'm sorry. Chesapeake College on March 31st at 5 p.m. Anybody who's got a question should come and ask their congressman. And so I'm Ridgely Ox. This is Mike Pullen from Talbot Rising, Bob Day, and we thank you so much for joining us.